Hi, my name's Dr. Greg Ruff. We're here in my office where we do surgery and see patients. So the procedure we're discussing today is called a microlift. And the name implies that it's a lot less surgery than a conventional face and neck lift. And the reason for that is because a conventional face and neck lift involves lifting up the face and the neck underneath the skin, all the way from the incision around the ear to the target area. And so the jowls, the central neck are the things that patients mostly complain about. That's a lot of undermining of the skin. It takes time, it costs money, it increases the risk, potentially the pain, and the downtime. So the undermining is necessary to get these areas tight when you pull on the back edge of the skin. The microlift uses an invention of mine that I came up with in 1991. This is a suture that has barbs on it in two directions. It's actually a monofilament thread that's got cuts made in it about a third of the way through that make a helix around the shaft of the suture. These little barbs are not metal. This isn't barbed wire. This is ordinary suture material. In fact, you can barb any type of monofilament. So the original ones were permanent suture, and what I'm using now is one that's a very, very long-lasting absorbable suture. But the point is that the barbs go in two directions. They follow the two needles, in this case from the temple, all the way down to the jawline. If you anchor it down here, you worry about pushing the tissue up and creating more crow's feet. So one of the things I started to do several years ago was move that anchorage up high in the temple. And that made it logical to lift the scalp up because it's quite easy and safe to do and allows for a greater amount of lift. The middle of the suture is anchored up high in the muscle you chew with. So I don't have to lift the face all the way down to the target. I can bring the barbs all the way down to the target with these long needles and hold the threads and push everything up to the anchorage point. So the procedure then relies on the fact that I've undermined the skin or the scalp. I've lifted it with this suture that's going to break in, like I said, typically 6 to 8 weeks. But by that time, the tissues are now going to be secured by the scar in the healing wound. So even after the suture breaks, everything doesn't fall back down. So once I've finished closing the wound, putting the staples in the scalp, we put a little antibiotic ointment on the wound and then some gauze to pad it to help with swelling and bruising. We then ask the patients to wear a wrap to help compress the area I operated on, but also to help support the lift. This is a polyurethane foam substance invented by a nurse. It doesn't have glue on it, but it just sort of sticks to itself. So we put this around the head and overlap it on the top. And the patients can take this off the next morning. If they'd like to shower and shampoo, that'll be fine. And I ask them to throw away the gauze and just wear that wrap as much as they can the first week. Initially, it's going to help suppress swelling and bruising, like I said, but later on, I think it's supporting the lift. It also, particularly at night, is going to prevent the patient from pulling down on their cheek and possibly undoing the lift a little bit. So this is a very elegant way to avoid a lot of lifting, a lot of pain, and so on. The sutures that I use now are unique. There's only one place in the world you can get a barbed suture made of what's called P4HB. This is a suture that lasts probably 8 or 9 months in a person's face. The original suture was made of a permanent material called polypropylene, and these had a commercialized name. They were called contour threads. They lasted forever, and we put these in about 500 or 600 patients. The outcome was a little bit less than perfect. About 75 or 80% of the patients were happy with this, but 20-25% of the patients said, I didn't see much of a lift. And so I think we're going to get better results. I've also started putting in twice as many sutures as I used before. And I think the patient's responses reflect that. We have a very high satisfaction rate.
I decided to do a thread lift because I felt like the traditional facelift had just too much recovery time involved, and I just didn't have that to give with my busy schedule. And for me, this recovery was 2 or 3 days and then a little bit of swelling for another week. But it was easily contained. I took some pain medicine for a couple of days and that was it. And as far as the results, I couldn't see them because of there was a little bit of swelling in the first couple of days. And then at the second 2-week visit, it was very pronounced. You could see a huge difference in improvement, and that waddle was totally missing. And now, with the little adjustments here and there, it has looked phenomenal, and I'm really happy with the results. I don't have this jowl hanging down here and this fullness in my cheek that I had prior, so I'm really happy with the way that turned out too.